In this video, I'm going to show you some special cases and some other miscellaneous things and also a complex calculation. So aspirin is a very old drug, and it used to be administered in grains, and now it is administered in milligrams. Now we know that 60 milligrams is in a grain, and used to be you might, or just for the just to do a calculation, you might have to make grains into milligrams. Well, if you take the 5 grains from over here and you multiply it by 60, you get 300, which is not 325. And if you take the 325 and you divide it by 60 milligrams, you get 5.4, and that's not 5. So you might be asking yourself, what is going on here? Well, you might think that you could take a tablet of aspirin and you could shave off some of it, to make it into 5 grains if you thought that the doctor was ordering, to give 5 grains. But you're not going to do that because you can never be sure, which probably is kind of obvious, that how much you're shaving off of the tablet. So for aspirin, we just say that 5 grains is 325 milligrams. They are equal, even though mathematically it doesn't come out right. And anyway, this milligrams is really not a hard and fast rule. It's just a estimate. If you look it up online, you'll see that it's goes out to several decimal places, and that's not exactly, we just round it up. Okay, so here is another one. Thyroid medication. We have here in the thyroid medication that it's distributed in 1/2 grain, and that is 30 milligrams. We know that 60 milligrams is in a grain. And over here, this one shows it in 0.25 milligrams, which is 25 micrograms. And I put this up here because, I've mentioned it before, but sometimes transferring from milligrams to micrograms, and where do you put the decimal, and do you go this way or do you go this way, or how many decimal places do you go this way or that way? So if you put this part into your equation, you won't have that problem of memorizing that particular factoid. Anyway, so you might be wondering, well, why is this 30 milligrams? That sounds like a really big dose if this one is 0.25 milligrams. And I can just tell you that this thyroid is more of a naturopathic, homeopathic type of thyroid, whereas this one is what you're going to find in the Western medicine formularies. So you might be given either one, but I just want you to understand that these are really not the same thing. You can see here that this 1/2 grain of thyroid, or 30 milligrams, is actually 19 micrograms of levothyroxine, which is levothyroxine. So I just didn't want you to be confused by that. These are not the same. These two are not the same. Cutting and splitting pills. You will learn how to cut and split a pill. You cannot cut a capsule. You should never do that, even though I have seen it online where they cut a capsule with a pair of scissors. You're never going to do that because it's not the right thing to do. If it has a hard coat, you're not going to cut it. If it is extended release, you're not going to cut it. Now, you might be asking, why would anybody want to cut a tablet anyway? Well, first of all, there's the problem with people who can't swallow a whole tablet. So they might need to cut a tablet to swallow the different pieces and get the whole dose. The other thing is and you might have heard of this before too, is that people, um, like say for instance, if they are ordered to have 25 milligrams of something and there is a 50 milligram dosage as well of that medication, they'll ask the doctor to go ahead and order the 50, and then they cut them in half, and then for the cost of, because there really isn't much difference a lot of times in the 50 and the 25 for various different drugs. There really is not much difference in the cost. So for the cost of 1 month, they really kind of get 2 months. So a lot of people do that. And then they end up splitting the pills, the tablets. A problem with doing this whole thing is that you could misread the 1/2 as being 1 to 2 tablets. So it could be written as 1/2, and then somebody says, oh, well, it says 1 to 2. And that's not the correct dose. You can see that for, critical drugs, that would be a very bad error. Also, too, I don't know if you can see it too well on this picture, but there's like a little line across this um, pill, and it is a scored, that's what they call it, a score, which is where you want to line up the blade when you're splitting it. Things that are scored you can generally split. So that is splitting. Now you might be asking yourself, well, how do I know that both halves have the same exact dosage of whatever it is? And you're exactly right. You don't. The problem is equal distribution of medicine in split tablets is questionable. This is from the FDA, and that is a problem, but we can still split pills. Generally, you're not splitting something that is really, really has to be exact. I will tell you that at some of the long-term care facilities, they make up bubble packs, and they already have the split pill in the bubble pack. Like they all have just a half of a pill in a tablet in the bubble pack. And of course, you would give that. Okay, so you can split and cut a pill, but only if you have to. Crushing. This is a little device that you'll get very familiar with where you can crush a medication. You put it in these little plastic bags, and then you put the plastic bag in the crusher, and then you use the handle and you can really crush that thing. Now, if it has a hard coat, you're not going to crush it. If it's extended release, you're not going to crush it. So that's crushing. And then you would put it in a cup. You'd pour out the ingredients from the bag into a cup and mix it with, applesauce or something, and then feed it to the patient, because probably the reason you'd be doing that is because they couldn't swallow a whole pill. Okay. So here is our problem. 10-kilogram pediatric patient is ordered to have amoxicillin. That's here, and this other ingredient. Now, when you read the label, this is the amoxicillin part. This is the other ingredient, and it's per 5 mils. So that's how that works. The recommended dose of this drug is based on the amoxicillin portion. 600 milligrams is 90 milligrams per kilogram per day, and that's given in divided doses of every 12 hours, administered for 10 days. How many mils is in a dose? So the first thing you know is that you're looking for mils. Here's the setup. We're looking for mils per dose. Here it is. Mils in a milligram. Milligram is here. Mil is here. Milligrams per kilogram per day comes from there. Kilogram of child comes from here. Days and hours, you know that 24 hours in a day, and hours in a dose, there are 12 hours between doses. So do the math and you plug in all of your numbers and you end up with 54,000 mils and 14,400 doses. Well, that sounds pretty silly, but anyway, here it is. And when you divide it out, here you have it, 3.75 mils of this suspension per dose for this child. That's per dose. Okay. Now, going back to that really long equation right here, you might think, I can't do that. I don't want to do that. That's crazy. Well, I totally understand that. So there is another way to figure it out. And that is where you just take and look to find out how many milligrams. What you do is you take the 10 kilograms of child and the milligrams per kilogram of child per day, and you use just that component to figure out the number of milligrams per day. So we have, here's the 10 kilogram child, the 90 milligrams per kilogram, and then we have the milligrams per day. So you multiply it. It's really 10 times 90 equals, and then here it is, 900. So now we know that we have 900 milligrams in a day. That's how many milligrams we're going to be giving. And then you just plug it into this shorter equation because you've already done that other part. So you don't have milligrams per kilogram per day in it. And here's the other one, again, just to go over this. Milliliters per dose, milliliters per dose, milliliters per milligram. Here we have milligrams, here we have milliliters. Milligrams per day, and that's from here, milligrams per day. And then we have days in a dose, and that's 12 hours, every 12 hours. So again, we get the same thing, and it is 3.75 milliliters in a dose, and that is the answer that you're looking for. I hope that this helps you to be able to figure out some of the questions on the practice sheets.